Hello, I'm Deborah Dinsmore. In partial fulfillments of the requirements of Nursing 5309 at the University of Texas at Arlington, this is the algorithm which I use as my teaching strategy for the following class of postpartum staff nurses. And I'm teaching a class of postpartum nurses at the hospital where I'm a clinical instructor, a short review course on neonatal resuscitation. I'll be using an algorithm, and I have outcomes both printed for them and on the board. This is in partial fulfillment of the requirements for Nursing 5309. As a clinical instructor for this facility, I'm in charge of both short-end services as well as certifications and competencies. Today I'm teaching this group of nursing this review course. Even though the majority of infants who are on this unit have no problems prior to discharge, these nurses need to know what to do in the event that a baby is not breathing or non-responsive in mom's room. Hospital policies covering this situation include the need for nurses to be certified in neonatal resuscitation, as well as the need to know how to reach the rapid response team from NICU. So we'll be talking about both of those in the algorithm. The nurses need to know what to do and what to do immediately. I will begin this discussion by having you all read a case scenario. It's actually based on a true story from this hospital. So if someone wouldn't mind reading that, if one of my...
Oh, sure, I will.
Thank you, Erin.
So, compromised newborn in mom's room. Nurse Andrea, she's an RN BSN, has been working on the postpartum unit of X Hospital since her graduation last spring from Y University. Her manager, educator, and peers consider her a hard-working, well-qualified young nurse. She receives many compliments from her patients concerning her care. On Tuesday morning, she was called to her room, 240, where the father was holding his day-old infant who was blue and appeared non-responsive. Andrea experienced a second of panic until her neonatal resuscitation training kicked in. This was not a delivery room scenario like NRP concentrates on, but this was still a blue, non-breathing, non-responsive newborn. According to her policy of X Hospital, what steps should Andrea implement in this situation? Have you ever been in her shoes? This situation could have an extremely negative outcome. So it is important that every nurse who cares for both mothers and babies on this unit knows exactly what to do and implements these interventions immediately. Let's consider the algorithm in place for this situation.
Did that sound familiar to anybody? Anybody have that happen? Nobody's ever had that moment of panic? Well, one of your peers told me about this. And she said after it was all over that she was really shaky and she was very glad that she didn't know what to do. Okay, so our algorithm here, care of the compromised newborn, you're called to mom's room, okay? You get there, our case study said dad's holding the baby and the baby's blue. So your question is the baby breathing? Okay. If the answer is yes, probably the baby's not blue. If the answer is yes, then you're just going to routinely take care of the baby, okay? Diaper change, whatever he needs or she needs, okay? If the answer's no, though, you're going to take that baby, trying not to panic, from dad's arms and get him to a flat surface. Why would you not put him in the crib? Yeah, and you can't work on him, can you? You got those sides. Get him to a flat surface. So you're thinking, where's a flat surface? What's suggested is the vanity of the sink, okay? You know, clear it off, whatever, but the vanity of the sink, because that's also very close to where our oxygen source is. And on each oxygen tubing, we have a bag like this that has a flow-inflating neonatal oxygen bag. So get him to a flat surface. Now, hopefully, this kid's only problem is that he needs to be bulb suctioned, right? And mom was half asleep and dad didn't know how to do it, okay? So you grab that bulb suction as you get him on the flat surface. Squeeze the air out first, suction first the mouth, then the nose, and you pray real hard that he's going to start crying. Please, he doesn't start crying. Okay, so then you've got another decision. Okay, If he does, we're just gonna reinforce bulb syringe use and routine care, okay, and say thank you. Make sure that both mom and dad know how, and I used to hand it, usually to dad, and say, show me how to do this, because you'd be surprised at the number of dads, especially, that put it in the mouth and then squeeze. What they're doing, they're sending stuff right down their throat. So pick it up, squeeze it, put it in the mouth, release it. Just sucks up whatever's there, then squeeze it out, do it again in the nose. So, you've done that very effectively, you're good nurses. This kid is still not breathing. Okay, what are you gonna do then? Okay? The first thing you're gonna do, the phone in your pocket, we all have a 4444, okay? That's our neonatal rapid response team in NICU. At this hospital, they're called Code Pink Team. And they pick up the phone on the first ring, because I've called them a few times just to make sure. They pick up the phone, you tell them you're in room 240 with a non-responsive infant. They come running. I mean, literally, because I see them run. The next thing you do is, we don't have a Code Pink button. They do in L&D, but we don't in postpartum. You hit the staff assist button because you need help, right? You can't do all of these things with just two hands, one set of hands. That staff assist button, okay, usually at the head of mom's bed, that will get you help. Usually the charge nurse is the first one to get there, okay? But you may have several postpartum nurses that come, okay? So you've called NICU, you've hit the staff assist button, you got the kid on a flat surface. You're doing everything you need to be doing. But the kid's all like this. He's got his chin all tucked under and all that. Get him in what NRP calls a sniffing position, okay? Which is slightly extended, not hyperextended, but slightly extended, okay? So that's your sniffing position. He's looking at the air like he's trying to get some air. You get your flow inflating bag, okay? Make sure it's connected to our oxygen source. See this oxygen source on the wall? Okay, make sure it's connected to the oxygen source. It doesn't have any oxygen going in it until you turn up the dial, right? We don't have blenders, we just automatically turn it. I always turn it to 8. They say between 5 and 10, I turn it to 8, okay? I've got oxygen going in this thing now. This bag fills up, okay, and then you put it on the baby's face with a good seal, and you count. When it's full, you squeeze it. That gives him the oxygen, okay? So it's like a waltz. Now, some of you are too young to know what a waltz is. I've had people look at me like, what's that? But it's breathe 2, 3, 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 breathe. You want 40 to 60 breaths per minute, okay? So, you know, that's a lot, okay? Got that rhythm? Okay. By then, the Code Pink team should be here, okay, because you've done these steps. If his heart rate is greater than 60, you're going to continue positive pressure ventilation, because somebody will have taken a heart rate by now. If it's less than 60, somebody's going to jump in and do chest compressions, okay? But by then, the Code Pink team's here. Okay, questions? Yes, ma'am, Liz.
Okay, some of these rooms are pretty crowded with stuff.
They are.
Is there a possibility that you could just pull the mattress out of their crib and put it on the hard surface of the crib?
You could. My only contention with that, and I've heard that discussion, is it's just hard to get people's hands down in there. But you know, if they have flowers and tin cups on the sink vanity and there's no way you can get there, you do what you can do.
Okay.
Yeah. Yeah, you could even put him on the foot of mom's bed. That mattress isn't as hard as you're going to need to be if you're doing chest compressions.
Or you could pull out the shell, the plastic shell, because there's still that little perimeter
Yeah,
in the bed, and just lay the baby on the, you know, the crib
that's a good
portion.
idea.
Oh yeah. If you took out the plastic shell.
Oh, gotcha.
On
Yeah,
the,
you just
Yeah.
lift
the roll,
out the
rolling
whole
part.
basket.
Yeah. And
Yeah.
there's a flat thing.
Then
there,
there's a
and
flat
then
thing
there's a
there.
little
Yeah,
runner all around.
yeah. You know, this is what we hope doesn't happen in mom's room, but we got to be ready for it if it does. Okay. What about more questions? Okay, know what to do? First thing is 4444, right? Second thing is staff assist button, because you're getting help from two places now. NICU's coming and the postpartum nurses are coming. And in the meantime, if that baby still is not breathing, you're going to start positive pressure ventilation by getting out your bag. Don't do it without turning on the oxygen. Turn on the oxygen. 5 to 10, put it about 8. Get a good seal. Breathe 2, 3, breathe 2, 3. Okay, more questions?